behavioral assessment is to behavior therapy what a banana is to a banana split. Indispensable. Behavior assessment procedures are used to gather information relevant to clarifying clients' problems, setting goals, selecting and designing target behaviors, identifying the maintaining conditions of the target behaviors, designing a treatment plan, and monitoring clients' progress. In this lecture, we will discuss the 8 most frequently used behavioral assessment methods, which are the interview, direct self-report inventory, self-recording, checklist rating scale, systematic naturalistic observation, role-playing, and physiological measurement. The first 3 methods, interviews, self-report inventories, and self-recording, provide information from clients' reports about themselves. The next 4 methods, which are the checklists and rating scales, naturalistic observations, and role-playing, employ other people to assess the client's behaviors. Finally, physiological measurements rely primarily on instrumentation to provide information. So, behavioral assessment is an indispensable part of behavior therapy. Behavioral assessment gathers information to clarify the problem, set goals, design target behaviors, identify maintaining conditions, and then design a treatment plan and monitor the client's progress. Behavior assessment is multi-method, meaning using more than one method of assessment. And it's also multimodal, and that means when we assess more than one mode of behavior. Behavioral assessment procedures are individualized, focus on the present, directly sample relevant behaviors, are narrowly focused, and are integrated with therapy. Now let's review the characteristics of behavioral assessment. In a sense, behavioral assessment is defined independently of the methods used. So whether assessment is behavioral in nature depends on how it is implemented and used. For instance, the interview is hardly unique in behavioral assessment. However, it emphasizes in the behavioral interview, such as focusing on current circumstances, distinguish it from interviews in other types of assessment. Behavioral assessment procedures share 5 characteristics, and they are: first, it is individualized. Second, focus is on the present, not the past. Third, directly samples relevant behaviors. Fourth, has a narrow focus. And 5, is integrated with therapy. An interview is usually the first assessment method used. Besides their role in assessment, initial behavioral interviews are used to establish rapport with the client and to educate the client about the behavioral approach. To gather information about a client's problem and its maintaining conditions, behavioral interviews focus on the present and ask questions concerning what, when, where, and how often, rather than why. Direct self-report inventories are questionnaires containing brief statements about questions that require a simple response or rating. They are highly efficient and are used for initial screening. Their validity depends on clients responding honestly and accurately. Self-recording involves clients observing and keeping record of their own behaviors. It is time efficient and can be used to assess both covert and overt behaviors. Clients must be motivated, however, to record and must make accurate recordings. Reactivity is a change in clients' behaviors because they know they are being observed. It is a potential problem with most observational assessment procedures. Now, behavioral checklists and rating scales contain lists of potential problem behaviors about which someone who knows the client well responds. With checklists, the informant indicates all the behaviors the client performs. But with rating scales, the information uses a scale of frequency or severity to evaluate the client on each behavior. Checklists and rating scales are efficient assessment methods. Now, systematic naturalistic observations are made in the situations in which target behaviors normally occur. These observations are most accurate when the target behaviors are clearly defined and observers are well trained. The reliability of the observations is assessed by comparing the observations of two or more independent observers. Potential problems with systematic naturalistic observations are reactivity, observer error, and bias, and also impracticality. Stimulated observations are made under conditions set up to resemble the client's natural environment. A one-way observation mirror is often used. A potential limitation is the ability to generalize what is observed in the simulation to the client's natural environment. In role-playing, clients enact problem situations to provide the therapist with samples of how they typically behave in those situations. Role-playing is especially useful in assessing social skills, such as assertive behaviors. Role-playing is an efficient form of simulated observation. No special physical arrangements are needed because the relevant environmental conditions are imagined. Clients act as if they were in the problem situation. With interpersonal problems, the therapist plays the role of the other people. The more clients are able to behave as if they were in this actual situation, the more likely it is that the behaviors observed will be valid indicators of how they typically act. Many clients initially feel uneasy or awkward engaging in role-playing. With practice, however, most clients can, get into it a little bit. The therapist must also be able to play roles realistically, which requires specific knowledge of how other people interact with the client. Generalization to the natural environment can be limited because when clients role play, they may behave differently from the way they typically do. Now, each behavioral assessment method has its strengths and limitations. The multi-method or the multimodal assessment helps overcome the limitations of single methods and provides more complete information about the client's problems. Initially, behavioral assessment focused on overt behaviors and systematic naturalistic observations. Today, direct self-report inventories, and self-recording that can tap cognitive and emotional modes of behavior frequently are employed. Now, in my next lecture, we will conduct a behavioral assessment using a case of domestic violence. Now that you have learned about each of the 8 major methods of behavioral assessment, we can illustrate the multi-method or multimodal nature of behavioral assessment with the case of a woman who was treated for excessive anger and violent behaviors. And we will discuss this all in my next lecture.